chest rise and not the stomach. If I see the stomach rise, I probably haven't tilted the chin up high enough.
So by pulling the chin back, you're opening the airway?
And allowing,
basically,
yep, exactly, oxygen to get to him. So if I had Narcan, at that point I would administer it. If not, I would continue to breathe for him 1 breath every 5 seconds, either until he started breathing on his own, which could happen, or until help arrives and was able to take over. So that's what we would do up to the point that we were able to administer the Narcan.
Hillary, as we saw in our demonstration, you had mentioned the use of Narcan as part of the recovery process. What is Narcan and how does it work?
Narcan, or naloxone, which is the generic form of it, is a complete opiate antagonist used solely for the purpose of reversing the effects of an opioid overdose. It's completely safe and effective. It can be used on pregnant women. It can be used on children. It's actually so effective that they've used it on 4 state police narcotics dogs. So the dogs go into a drug bust, they get aggressive, they're there, they find it, they inhale it, they ingest it, and now the dog's going to die.
Because they're sniffing.
Because they're sniffing.
For drugs,
That's exactly.
Inhaling exactly.
Yeah, and it's like a game to them. So, now the dog's ingested heroin, for example, and the dog's going to die of an overdose if you don't do something. So they've actually used the nasal Narcan on these 4 police dogs and saved the dog's life.
Wow.
So to me, if it's that safe and effective, it could be used on me. And when we talked a little bit earlier about different substances that are used in drug treatment, a lot of negative things come up about them. Methadone and Suboxone, they're still opioids, so people can abuse them. You can't abuse this stuff. It's not going to get you high. It's just going to prevent you from getting high.
So there's no way to overdose on administering a Narcan.
There's no such thing as giving someone too much Narcan. So what Narcan does is, remember when I talked about the receptor and the opioid in the brain? So it goes into the brain and it has a greater affinity to the receptor than the opioid does. So basically all it does is pop the opioid off the receptor, fit into the receptor, blocking the opioid from going back into the receptor for about 30 to 90 minutes. Now, when the opioid's not in the receptor, it allows for the person to start breathing again. It allows for that receptor to send that message, I need to breathe, and basically completely reverse the effects. It comes in 3 forms. The Department of Public Health has 8 Narcan pilot sites where you can go in as long as you're over the age of 18 and you can say, I'd like to get some Narcan. It's completely free. It's a confidential process that they use nomenclature. So you're not saying, hi, I'm Hillary Dubois, please sign my name and attach me to this. No. It's the first 3 letters of my mother's maiden name, and then the first and third letter of my first name, and the first and third letter of my last name.
So it's a code that they use to just keep track of what they've made available, and it has no bearing on the individual who would be asking for the safety valve.
Exactly. And Narcan is a prescribed medication. So aside from these 8 pilot sites that are we're lucky enough to have one in Brockton, which is really, it's a huge thing that we have both a coalition working on overdose prevention as well as a nasal Narcan site. There are shared sites in New Bedford and Fall River have a shared site. Hyannis and Provincetown have shared sites. Springfield and Northampton have shared sites. Then Quincy, Boston's covered, Cambridge, Lynn, and Gloucester. So it's really not covering much of the state. But we're lucky enough to have one, 81 Pleasant Street, right across the street from here. So basically, otherwise it's a
And anyone who finds or feels that they have a relative, a loved one that may be potentially subject to having an addiction or an overdose, they could be able to go in and they could ask for this particular product, and they would be given it as a security blanket to in the event of an overdose potentially.
Exactly. As long as you're over the age of 18, it's for free. The way that I look at Narcan is, my brother's allergic to bees. We have an EpiPen for him. In the event that he were stung by a bee, it would be a life-threatening emergency. The Narcan's going to reverse the effects of the overdose the same way the EpiPen's going to reverse the effects of the anaphylactic shock that someone goes through. But there's a doctor, a medical director of the Narcan pilot site, Dr. Wally, who signs off on all of these prescriptions. And it's like a standing order because you're really not going to use Narcan on yourself. You're going to use Narcan on someone else. So it is a prescribed medication though. And it comes in the nasal form because a few other states have Narcan, and Narcan also comes in injectable forms, but the Department of Public Health, they didn't want to deal with needles. But the two other forms that Narcan comes in is most commonly when paramedics administer Narcan, they do an intramuscular shot in the arm or the butt or the thigh. It also comes in an IV form. So someone, for example, might be on a really, really high dose of a long-acting opioid like methadone that stays in your system for a really, really long time. They might need a lot of Narcan. They might actually need to be put on a drip of Narcan for several hours. Okay. The same way I can't tell you how much of an opioid it's going to take for someone to fall into an overdose, I can't tell you how much Narcan it's going to take to pull them out of it. But like I said, there's no such thing as giving someone too much. So
the Narcan, in essence, in this example that we're looking at, where we had a person overdose, is really a bridge to respond immediately at the point of overdose that you recognize until the medical assistance arrives.
Exactly.
So it's really a bridge.
It really is. And it's going to allow the person to start breathing again. Now, what's important to note is when you get a kit from one of these sites, there's 2 doses in each kit. On these orange boxes, there is a sticker, and that's required on all of them, and it says that this comes from the Department of Public Health, and it has the Mass General Law, Chapter 94C, that says that this is not grounds for search and seizure, this is not drug paraphernalia, I am legally allowed to have this.
Even though it's a prescribed
It's a prescribed medication, I can have it.
Okay.
There's 2 doses in each kit. There's 2 milliliters in each dose, which is the standard paramedic dose, okay? There's also other things in here, like a little booklet on information. If you get it from the Cope Center, they also have a breathing mask. So for example, you go to McDonald's and someone's turning blue and you wanna do something, but you don't know that person and you're a little leery about putting your mouth on their mouth, there's a breathing mask. Rip that out, put it on the person's face, you can breathe for them. Because that shouldn't be a reason that you're not gonna help someone.
Right.
So, basically what Narcan looks like is, in the orange box is the actual medication, Narcan or naloxone, which is a clear liquid. It does have a little bit of a scent to it. And then this barrel that's used basically to ionize it. In a separate sterile package is the nasal tip. And I strongly encourage anyone who gets enrolled in Narcan, you can pre-assemble part of it, because this can be kind of difficult to put together, especially if you're in an emergency situation and you're scared. But you don't want to put the whole thing together, because Narcan that's exposed to oxygen for too long can become a little less effective, and you don't want the stuff to become less effective.
So it loses its potency.
If it's exposed to oxygen for too long. It's a pop and screw configuration. Everything pops off and everything screws in. So basically what that looks like is you pop the yellow top and bottom off, and then you take the nasal tip and you screw it right in. Now I've done this about 100,000 times, so I make it look really easy. It's not, if you're in a panic situation, this could be really difficult to do. You'd leave it like this, okay? And you kind of want to leave it at room temperature. Because if it does get exposed to the elements, it can be a little less effective. Plenty of people have left it in glove boxes and used it and it still worked. So if you have to use it, you just take the top off, you'd push the barrel into the syringe, you put the tip in the person's nose, and you push half up each nostril.
An aerosol, kind of.
Like Flonase, like anything else, If you do half up each side, it's going to allow for the person to start having the opiates jump off the receptors.
Is there a knee-jerk reaction to the addict or the person who may have passed out?
There might be, there might not. It's totally individualized. So you give the person 2 breaths and you administer the Narcan. Then you continue to breathe until either the person came out and started breathing on their own or until help arrived.
And you're looking for that chest expansion as you're providing breathing for them. Okay.
After about 3 minutes, if the person doesn't come out, you'd want to administer a second dose. Just rip this off, hit them again. There's 2 responses to being Narcaned. The first is to come out and not feel great. The second is that the person could go into withdrawal because the opioids aren't in the receptors. So it's important to know that someone who comes out might not be in a great place, might want to go and use.
Okay.
They won't be able to get high while Narcan's in their brain for 30 to 90 minutes. Once the Narcan wears off, someone could re-overdose or they could be high again.
If they were to be ignorant enough and go out and try to use again, it's not going to be beneficial? Is there a potential of an overdose at that point?
Absolutely. They wouldn't overdose until the Narcan wore off.
Wore off an hour or so later.
Right, but once it wore off,
it would hit them like a brick, potentially.
Exactly. The safest place for someone after an overdose.
So if you use this product, it's best to make sure there's some medical follow-up shortly thereafter.
Get them to the hospital.
Yeah, get them to the hospital to be looked at.
It's the safest place.
This has been a great show. I hope that our viewers have learned a lot about what the Brockton Mayor's Office of Opiate Overdose Prevention provides us here in the city of Brockton and throughout the South Shore community. I know you're out there every night. I've seen you at other demonstrations and educational conferences out there throughout the city where you have demonstrated what you did for us tonight and what you hopefully do for everybody out there. I want to thank you for being here.
Thank you.
Hillary, it's always a pleasure to see you and meet with you, and thank you for joining us tonight.
Great. Thank you so much for having me.